Welcome to Little Short Takes with Dr. Stephanie. I thought I'd like to share a little bit of the research that we are finding through the survey that we put out several weeks ago. It'll take probably several months to get the research put together, as I'm still working on the qualitative semi-structured interviews and then putting together the research article and then finding publication in a peer-reviewed academic journal. So there is still a long ways to go before there is written research available. However, I thought I would like to share every once in a while some of the things that we found from our 319 participants. So this one, I want to talk about why are adults on the spectrum being missed? And so if you're a clinician, or maybe you want to share this with a clinician, as a former LPC and now a certified autism specialist, I want to share with my fellow clinicians and pastors and people who are in marriage ministry and work why it is so important to be trained concerning adult diagnosis for people on the spectrum. So I want to share with you, in our research, to share a little bit what we did, we put together a survey of those who are identified on the spectrum, either through self-identification or professional psych evaluation. What were the reasons that clinicians in your life first missed your diagnosis, and what were the reasons that clinicians or people helpers gave you as to why you could not be on the spectrum or why your spouse could not be on the spectrum? The number one answer was 67 respondents said, which was about 20% of our population, because they have at least one friend and they appear too social. Okay, so this is very interesting to me, fellow clinicians. So why would someone on the spectrum, if they have a friend or if they appear social in public, why would that disqualify why that one thing would disqualify someone from being on the spectrum? So it's a myth that people on the spectrum just prefer to isolate or don't want to be in groups or don't have friends or don't know how to make friends. So I think when you're diagnosing and you're looking at evidence and you're looking at children, I think that is far different than when you're talking about adults, because people learn compensatory strategies. Also, we know through research that people on the spectrum in trying to sometimes fit in, or the pressure to fit in, might be masking or camouflaging to fit in. And so many times in a therapeutic office or during an assessment might be masking. And so this, let's bunk this myth that because someone has a friend or appears social, that they cannot be on the spectrum. The next myth that is a problem is 62 of the respondents, so 19%, said they didn't get the diagnosis, or someone said they could not be on the spectrum because they were too successful in their work or in their career. Now, many people who are on the spectrum are actually working in a special interest or an area of expertise or a niche that becomes their work or career. In fact, Dr. Temple Grandin speaks about this. She encourages people on the spectrum to find something that they love and something they can be really focused on, that they would be great at. Lots of colleagues talk about a great match is work and being at work. There's a very different skill set that is required for being at work and working relationships than being at home and marriage and family relationships. The expectations at work are usually clear cut. What is expected is less relational and more focused on the work, the project, and clear-cut rules. So because someone is too successful in their work or career, we have to debunk that because many people on the spectrum are in successful careers. I think one of the most famous who said they had Asperger's is Elon Musk. So I guess based on these 62 people who had these evaluations came back, I guess Elon shouldn't have a diagnosis because he's too successful. Another one came back, 33 respondents, which is 10%. Well, he or she got married, so they can't be on the spectrum because, again, AS people prefer isolation. So the clientele that I work with is our neurodiverse Christian couples or neurodiverse couples. So obviously, many people are getting married. I like to constantly refer back to scientific study that was done back in 2019 through JAMA, that's JAMA, and it was a 2.1 million participant study. That's huge. There are claims made on smaller studies. So 2.1 million participants across 5 countries, which was a longitudinal study. This is a ginormous study. And they found that 80% of autism level 1 without cognitive impairment is hereditary. So that must mean people are getting married or being in relationships that have a sexual relationship. That means there is offspring or children. So we have to get rid of that myth that simply because someone got married that they can't be on the spectrum. Another one that came in, 56 respondents or 17% said that the provider, the clinician, whoever was doing it, said they can't be on the spectrum because they have good eye contact or maintain good enough eye contact. Okay, so if you go to the DSM-4 or the DSM-5, just because someone has eye contact does not mean they cannot be on the spectrum. If you look at things under what it says might be difficulties with social cues and social communication, it lists an example that eye contact could be one of the things that there are struggles with, but it doesn't mean that one has to not be able to have eye contact to be able to be on the spectrum. Also, if you're thinking about children or thinking about adults, from childhood to adulthood, there is usually a lot of feedback about eye contact. And so there can be compensatory strategies. So again, if you're thinking that someone who makes it to an adulthood who has a relatively successful career might not have picked up some things along the way, that just because in an office setting for an hour, 2 hours, or 3 hours was able to fake eye contact. I teach some of my clients all the time how to fake eye contact, how to look like you're looking at someone's face if it's just too difficult to be able to give someone that face contact where you can look to at least be peer. So you can learn compensatory strategies. 38 respondents, which is about 11%, said the provider said that their interest or passion was normal or just a hobby, and maybe it wasn't weird enough. Well, a restricted or special interest, as is categorized in the criteria, does not have to be weird. Again, it can go back to being where a person has a niche and expertise and is very successful. You can listen to one of the podcasts we did with Perry Carpenter, where we talked about, is it a special interest or is it a niche? Also with my daughter, was it a special interest in history or does she have a niche in working in museums and in the area of history? So having the restricted special interest does not have to be weird. It doesn't have to be childish. It can be a hobby or something that has gone, it's about the intensity and it's about how much it interferes with other things in life. Like there's a sports fan and then there's a radical sports fan. And then if someone is on the spectrum and they have a sports interest, that's going to look quite different. So this restricted special interest or the passion or interest does not have to be weird to qualify for being on the spectrum. 62, so this was about 19%, 62 respondents said that the provider said that they are too smart or their IQ is too high, they're too intelligent. So we have to go back to remembering that autism and cognition are two different things. That is one of the very important things, although I'm not I don't love everything about the DSM-5 and everything that they did with autism. But one thing I think that is very important is separating autism from IQ, because many people still hold on to the idea that autism equals to a low or impaired IQ, or the old terminology, mental retardation. And so it's very important to keep these two things separate. Autism is its own spectrum, and then there can be exceptional IQ, or there can be impaired or low IQ. That is an identifying or a specifier to the autism spectrum. So it's very important that we continue to separate autism and IQ, because that's one of the stigmas, and that's one of the reasons that it's very difficult for some adults on the spectrum to be able to accept the diagnosis, is because of the negative stigma that is still out there, that to be on the spectrum means to somehow be of lower IQ, and that simply is not true. So professionals, we need to do better. This one was interesting. 23 respondents, they aren't clumsy. In fact, they are athletic. So there is nothing in the DSM that says a person has to be clumsy or cannot excel in sports and be on the spectrum. Now, if you kind of look up some general guidelines, if you were to pull up criteria or guidelines for being on the spectrum, it is true that many people, and especially children, maybe because of developmental milestones, may be a little clumsier or awkward. But again, that is not a criteria for the diagnosis. And in fact, there can be people who are in various athletes that are on the spectrum. This one was really interesting. 40 respondents, which was 12% of the population, said they can't be on the spectrum because they're just too well liked. Everybody loves them. I don't even know what to do with that one. Do I really need to explain that one? They are too well liked, everybody loves them. I don't even know what to say with that one, except for that's wrong. And if you're a professional, why would you think that? If you would think that people on the spectrum can be very lovable, likable people. So where does that even come from? That because someone's likable or too well liked, that they can't be on the spectrum? That one's a ridiculous one, y'all. That's just ridiculous. That's ridiculous. And this is my biggest pet peeve. And if you're saying this, please stop saying this. This makes me absolutely crazy. Everyone is somewhere on the spectrum. Okay, no, not everyone is somewhere on the spectrum. And the autism is just becoming overdiagnosed. 43 respondents had that. Respondents are 13% of the population. So no, not everybody is on the spectrum. Now, can different people have spectrum traits? Well, of course, there can be people that have a cognitive profile. I have sensory issues, but I'm not on the spectrum. You can have sensory issues. Every person with autism has some sort of sensory profile, but not every person with a sensory profile is on the spectrum. Can some people be really organized and stick to routines? Well, of course, there are a lot of people who have that aren't on the spectrum. It's the combination of the criteria that come together to be on the spectrum. So we need to stop saying that everyone is a little bit on the spectrum, and we need to stop saying that autism is overly diagnosed. I think right now the CDC is placing 1 in 54 children that are on the spectrum. But let's go back and remember that in the 1990s is when the DSM-4 and DSM-4-TR came out with Asperger's and high functioning autism. So that's 1990s, which is when my daughter was born in the late 1990s. So there's a whole generation of people that have been missed without this criteria. And then even for those who have been diagnosed, or since we do have these new criteria, still being missed because of all the myths and stigma that's going on. I was talking to some colleagues, and they feel like maybe part of the reason is that with the DSM-4 and the DSM-4-TR, when we were giving diagnosis, we would also have to give a GAF, or a global assessment. of functioning. And so if someone's GAF was kind of a certain level or number, then a person really wouldn't qualify for a diagnosis. And I think we have to put that aside. That's not a part of the DSM-5. That's not a part of current diagnosis and criteria. So if you're under that old thinking, DSM-4 and before of the GAF, the functioning, people on the spectrum can function very well at work and then be struggling in other social relationships. And so I want to invite you, if you're a clinician, a pastor, a Christian worker, a coach, a biblical counselor. I have one more pet peeve for my biblical counselor friends. And that's, we don't believe in labels, or we don't like to use labels. Well, that can sound very kind. That is very dismissive. Also dismissive is we don't believe in autism, or we don't talk about autism because it's not in the Bible. And that also is silly to me, because the word Trinity is not in the Bible, but we believe in the Trinity as well. So we can't be that simplistic. To say that simply because the word autism is not in the Bible, or we don't have evidence in the Bible that autism doesn't exist. And we can't say that we just can't use labels, because knowing about autism and knowing about how autism impacts a person and their relationships and looking at marriages, you're going to do a disservice. As I start to get more information out in my research, that's the number one thing that Christians who are in neurodiverse Christian relationships are saying, specifically about their interactions with Christian counselors, Christian coaches, and pastoring clergy, is that when they bring autism up, it's dismissed. Either the person doesn't know what to do, or they say every marriage is difficult, every marriage has struggles. The things that I'm going to teach you are going to work. Don't worry about it. The autism doesn't matter. The autism, the neurodiversity absolutely does matter. So if you don't know about autism in adults, if you don't know how to do the differential diagnosis, if you want to know more about how to serve your couples who are neurodiverse, we invite you, go to www.christianneurodiversemarriage.com. Click on courses. There's a set for professionals. I am happy to walk you through the history of autism, the diagnosis, the criteria based on my dissertation research. Why is autism even in the DSM in the first place when it's not a mental health condition? What's the history of it? What's the stigma of it? What are confusing things that are difficult to differentiate from? What about when there's a co-occurring issue? How might that change the presentation? Things you want to understand about autism, adult relationships, marriage, impact on marriage, and why it's being missed, and some things that are just not going to be helpful in working with neurodiverse couples. So again, we invite you, go to www.christianneurodiversemarriage.com, courses, click professionals, and we would love to help you be autism aware and autism trained as you better educate, equip, serve, and come up with effective strategies for the neurodiverse couples that you may be working with.